Have you ever heard about placenta previa? It's a condition that can occur during pregnancy. This term may sound complicated, but it's rather straightforward. Placenta previa is when the placenta, the organ that nourishes your baby, covers the cervix, either partially or completely. Imagine a door being blocked by a large object. That's what's happening inside. It's not the most common condition, but it's significant enough to warrant our attention. Now that we know what it is, let's move on to what causes placenta previa. So, what causes placenta previa to occur during pregnancy? Well, several factors can increase the risk. Age plays a role. The older you are, the more likely you are to experience it. Multiple pregnancies can also be a factor, as each pregnancy increases the chances. Prior surgeries on the uterus, including cesarean sections, can contribute as well. Lastly, if you've had placenta previa in the past, you're more likely to have it again. Knowing the causes is half the battle. But what about the symptoms? How do you know if you have placenta previa? Understanding the symptoms of placenta previa is crucial for early diagnosis. The main telltale sign is unexpected bleeding during the second half of pregnancy. This isn't your typical spotting, but heavier bleeding that can start and stop without any pain. You might also notice that the blood is brighter red than usual. Remember, every pregnancy is unique, so symptoms can vary. If you experience these symptoms, it's important to consult with your healthcare provider. But what happens next? How is placenta previa treated? Treatment for placenta previa depends on various factors. Now, let's talk about some common treatments. Bed rest is often recommended to minimize bleeding. In many situations, a cesarean delivery becomes necessary to ensure the safety of both mother and baby. Sometimes, early delivery might be suggested if the bleeding becomes too risky. But remember, every pregnancy is unique, and so is every case of placenta previa. Always consult with your healthcare provider for the best course of action.